Welcome. This is the annual employee training for Tolad employees. We have a pretty big agenda, so there are quite a few things that we're going to be talking about today. This particular training will last about 1 hour and a half, so we'll go ahead and get started. First, we're going to be talking about Tolad policies. The Tolad policy book is located in each of the homes at Tolad, and it's also located in the Tolad office. And you have access to these policies anytime you need. You have access to them anytime. So the first policy that we're going to be looking at is the reporting and review of maltreatment of vulnerable adults. A vulnerable adult is someone who may not be able to protect themselves from harm or exploitation due to their age or their disability or their health condition. All clients receiving services from Tolad are considered vulnerable. Maltreatment means abuse, neglect, or financial exploitation. And when we say abuse, we mean sexual abuse, physical abuse, or emotional abuse. You, as a Tolad employee, are a mandated reporter, which means that you are required by law to tell someone if you think a person is being hurt or not treated properly. If you're not sure if it's abuse, report it anyways. Tolad will investigate it further to determine if maltreatment has happened or not. You, as a mandated reporter, must report it. If you suspect maltreatment in any way, you must report it within 24 hours. If someone is in immediate danger, call 911 right away. If they're not in immediate danger, you can call the Tolad office, or you can contact me, Missy Loveday, at 612-564-8069. And lastly, if you suspect that an adult is in immediate danger or if there's abuse in some way, you can contact the Minnesota Adult Abuse Reporting Center. And that is an acronym that's for MARC, MAARC. So you can call the Minnesota Adult Abuse Reporting Center anytime that you suspect an individual might be being mistreated in any way. I suggest that you take a screenshot of this slide and save this information in your phone. So if an incident or a potential maltreatment would ever happen, you would have these numbers in your phone. But also remember, these numbers are in the policy book for how to report a maltreatment for an adult. Next, we're going to be talking about the policy regarding reporting and reviewing of the maltreatment of minors. A minor is a child that is age 17 years old or younger. Again, you are a mandated reporter. You are required by law to tell someone if you think a child is being hurt or not treated properly. If you're not sure if it's abuse, it's okay, just report it anyways. Tolad will investigate it further to determine if maltreatment has happened or not. And again, if you do suspect maltreatment in any way, you must report it within 24 hours. If a child is in immediate danger, please call 911 right away. If they're not in immediate danger, you can call the Tolad office, or you can call the designated manager, which is me, Missy Loveday, or you can contact the Department of Human Services. And lastly, you can also contact the local county social services agency, and you can see the numbers here. There's one for daytime and one for weekends. Again, I suggest taking a screenshot of this slide and save it in your phone in case you ever need it in emergency or that if you suspect abuse in any way. But always remember, these numbers are in the policy book. So if you ever need to reference them there, they're in the policies. Next, we're going to be talking about client rights. Individuals have rights. The people we serve at Tolad have rights. To name a few of those rights, they have the right to help plan and review their services that they're going to get. They have the right to receive services that respect them and consider what they like and their preferences. They have the right to say no to services and to stop services. And they have the right to know what would happen if they did stop services. They have the right to know if a program can meet their needs before they start receiving services. They have the right to understand the rules and terms for getting services, like what might happen if they stop or pause services. They have the right to get help in moving their care if they decide to switch to a different provider. They have the right to know what services the program offers and how much it costs. They have the right to know that their care will be paid for, and if anything would need to be paid out of pocket, they would know. They have the right to know ahead of time. They have the right to be trained, have trained and competent staff. They have the right to keep their personal and financial health and medical information private. They have the right to see their records and their information in the program at any time that they want to. They have the right to be safe from abuse and mistreatment, and they have the right not to be physically controlled by staff. They also have the right to not be held and physically restrained in any way unless it's an absolute emergency. Individuals have the right to get services in a clean and safe place. They have the right to be treated nicely and have their stuff respected. They have the right to follow their cultural practices and their religion. They have the right to be treated fairly, no matter what their race or gender or age or belief or who they like. They have the right to know how to make complaints and to get help if they have problems. They have the right to know who to contact for help and how to complain if they need to. They have the right to use their rights with anyone else being mean to them for using their rights. They have the right to decide if they want to take part in research or new treatments. They have the right to pick their own friends and to spend time with them. They have the right to privacy. They have the right to have a lock on their door. They have a right to do activities that they enjoy. They have the right to their chosen activities, and they have a right to access their things and their money whenever they want to. And then there are additional rights for individuals that live in a home like Tolad. For those individuals, they have the right to free daily private access to and the use of a telephone for local calls or long distance. They have the right to receive and send mail and have emails and not have them opened by anybody else unless they ask. They have the right to use and have free access to common areas. This includes access to food at any time and access to freedom to come and go as they want. They have the right to choose how to furnish and decorate their bedroom or their living unit. They have the right to choose who visits and when they visit, and to have visits in their private room, or they have the right to have visitors in their bedroom. They have the right to have visits with their spouse or family member or legal counsel or religious guide or any others allowed in Minnesota statutes. They have the right to have access to 3 nutritious meals and nutritious snacks between meals each day. They have the right to have access to food and water at any time. And lastly, they have the right to have a home that is clean and safe and meets the requirements as required in Minnesota statutes and the state fire code. Rights restrictions. It's part of our job to ensure that everybody's rights are protected, and we can only restrict somebody's rights if it's due to their health, safety, and well-being. And if we decide to restrict someone's rights, there's only a few of those rights that we can actually restrict. And we should write down what rights are being restricted in their support plan, and we should only limit their rights in the least controlling way possible while keeping them safe and by helping them. If we restrict somebody's rights, we need to have a written justification why we're restricting that right. We need to write down why we need to restrict that person's rights, and we need to write what are the clear goals to stop restricting that right, because we always want to work towards not restricting the right. We need to have a plan for how to give their rights back. And we need to meet with the team at least twice a year to talk about how we're going to give that right back. And the person and their legal representative, they need to sign a date showing that they agree to this rights restriction. And we can only limit a right if we have their approval. And the person, if they have a legal rep, they can change their mind at any time. And if they do change their mind, the legal rep, we must stop restricting the right away. Next, we're going to be talking about the positive supports rule. So in 2009, families came together to file a lawsuit against DHS because restraints and seclusions were used in a way that violated client rights. So in 2011, the court approved the Jensen Settlement Agreement. The court and DHS settled on what now is called the Positive Supports Rule. And what that rule means is that there's no more using of devices like handcuffs or tying someone's legs or using leg irons or limiting a person's movement. You can only use an emergency use of manual restraint in an emergency. You can't just use a manual restraint for any reason, only in an absolute emergency. And also, the positive supports rule means to stop isolating people or using drugs to control their behavior and to start using best methods to help people with disabilities, making sure that people are in places that match their goals and their dreams, and teaching staff to focus on people's needs and using positive support strategies to help them. The Department of Human Services agreed to obey all of these court orders, and Minnesota is constantly making changes for people with disabilities under a plan called the Olmsted Plan. DHS will find the right places for people to match their needs and choices, and DHS will regularly update the court on how they're meeting these terms of agreement. So you're going to be hearing a lot about the positive supports rule, and we're going to be talking about bits and pieces of that positive supports rule in the next slides. All right, so the positive support strategies. Positive support strategies is a way of helping people by focusing on their strengths and skills and abilities and teaching them new ways and different ways of behavior without using manual restraints or any kind of restrictive methods. And these strategies must be included in each person's plan, and they must be reviewed at least every 6 months with the person or their legal guardian. To create and use positive support strategies, providers need to do a personalized assessment, focusing on the person's strengths. They should choose strategies that have evidence that they work and that the positive support strategies are centered around the person, and making sure that these strategies are ethical and they help the person become a part of their community and that they're the least controlling for the person, and that making sure that these strategies are effective. In each person's plan, there are positive support strategies incorporated throughout their whole plan. Some examples of positive support strategies, and there are a few here, but there are several more than are just listed here, but I wanted to give you some examples of what a positive support strategy is. So for example, a positive support strategy could be shifting the focus by verbally redirecting the person to a desired alternative activity. It could mean follow the individual strategies in the person's support plan addendum. It could mean shift the focus by verbally redirecting the person. It could be modeling desired behavior. It could mean reinforce positive behavior, offering choices, including activities that are relaxing and enjoyable to the person, using positive verbal guidance and feedback, using active listening to a person and validating their feelings. A positive support strategy could mean creating a calm environment by reducing sound or lights or other factors that may agitate the person. A positive support strategy could mean to speak calmly with reassuring words. Consider your volume, your tone, and your nonverbal communication. A positive support strategy could mean to simplify a task or routine or to discontinue until the person is calm and agrees to participate. A strategy could mean respecting the person's need for physical space and privacy. These are all examples of positive support strategies, and they are unique to each individual's needs. So next, we're going to be talking about person-centered care or person-centered planning. An introduction to person-centered care. Over the last several decades, there has been a time of change in the way that we provide services to people with disabilities. Supports have moved away from segregation and institutionalization, and we have moved towards support that encourages people with disabilities to participate fully in their care. Person-centered care includes care that focuses on the individual needs and their preferences and their goals. It's a shift from old school thinking from a traditional one-size-fits-all care. It's more about care that respects the individual's choices and their environment in their own support. Person-centered care approach leads to more satisfied individuals and more rewarding work for the caregivers. As you can see in this black and white photo here, care used to be very institutionalized, and individuals with disabilities used to be segregated and not allowed out into the community. And people with disabilities did not have a lot of choices. And there used to be a lot of restraints and things happening to these individuals that were restricting their rights and dignity. Now, we shift focus to the colored photo, which shows now that more person-centered care. People have more choices in how they're receiving services. They have more choices in how their support plan looks. They have more choices in how staff treat them. They have choices in how they want to receive help. The core principles of person-centered care includes respect. So treating individuals with dignity and honoring their choices. It includes choice, supporting individuals to make their own decisions, and dignity and recognizing and valuing each person's self-worth. Self-determination, which means empowering individuals to direct their own care in collaboration and working together with individuals to plan and implement their care. So now we're going to be talking about the core principles. So core principles mean respect and dignity, choice and empowerment for the individual. Every person has unique preferences. They have their own history, they have their own cultural backgrounds, and they have their own goals and dreams. Effective person-centered care involves actively listening to and understanding these aspects. This understanding forms the foundation of the tailored support plans that are important to the person and important for the person. So we're finding a balance of what's important to the person and what's important for the person. And we're taking into consideration their hopes and their dreams and their gifts and what's important to them, and helping them come up with an action plan for how to make their dreams come true. Developing a person-centered plan is a collaborative process involving the individual, their family, and caregivers or care providers or anyone else they would like on their team. The plan focuses on individual goals across various aspects of their life, including health, relationships, personal development, and we have regular reviews and updates to ensure that the plan remains relevant and meaningful to the person. So we're taking a look at all the different aspects of a person's life, relationships, hopes and dreams, their daily activities, their community support, their community involvement, their mental health, their physical health. And we're all coming together, collaborating on a plan that is person-centered for them. And we're regularly reviewing that plan to make sure it makes sense and to make sure that it's meaningful to the person. Person-centered care involves good communication. And what good communication means is active listening, giving full attention to what the individual is saying, and taking time to understand the points that they're being made. So good communication means empathy, putting yourself in the individual's shoes to understand their feelings and their perspectives. And it means clear and respectful dialogue, communicating in a way that is easy to understand and respects the individual's choices and opinions. In order to have good communication, it means active listening. So what active listening means is being really attentive, asking open-ended questions instead of just yes or no questions, asking probing questions, requesting clarification, paraphrasing what the person said, being attuned to and reflecting their feelings, and then summarizing what you heard the person say. Good communication skills is very important when you're coming up with a person-centered care plan for the individual. At Tolad, we empower individuals to make their own choices. We support individuals in understanding their choices and the potential outcomes of their decisions. We provide information and support to enable informed choices, and we respect and support the individual right to make their own choices, even if it involves risks, and even if we don't agree with them. It's always a balancing act when you balance safety and risk. So at Tolad, we recognize the importance of safety while also valuing the individual's right to take risks. They have the right to take risks, and we find that balance between protecting the individuals and allowing them freedom and dignity leads them to fulfilling lives. They have the freedom to make mistakes. They have the freedom to fail at something. They have the freedom to risk. And we involve individuals in discussions about the risks to ensure that their views and preferences are considered. Now, there might be some challenges, which may include resistance from others. Others might have difficulty understanding an individual's preference or balancing individual choice with safety concerns. Some strategies to overcome that are, providing education and providing advocacy and developing a creative solution that respects each client's preference while ensuring their safety. So it's finding that balancing act of allowing a person to make mistakes and to have risk, but also maintaining as much safety as we can. And we do that also by educating the team and the person on the risks. Next, we're going to be talking about the policy and procedure on emergency use of manual restraint. So emergency use of manual restraint means using a manual restraint when a person poses an immediate risk of physical harm to self or others. And it is the least restrictive intervention that would achieve safety. Tolad staff are not allowed to use an emergency use of manual restraints. There are several prohibited procedures, which means that these are never allowed to be used for a person under Tolad's care. And some of these prohibited procedures include chemical restraint, which means giving them medicine to chemically restrain them, or a mechanical restraint, which means we can't put handcuffs on them. We can't do any kind of mechanical restraint. We can't manually restrain them. We can't hold them. We can't seclude someone. We can't put them in timeout. We can't use any aversive or deprivation procedures. We can't put them in a prone restraint, which means that we can never, ever put someone in a prone restraint, which means that we put them down on the ground on their stomach and hold them down. We cannot do that. We can't use shock. We can't speak to the person in a way that is ridiculing them or demeans them or threatens to them or threatens to abuse the person. We can't use physical intimidation that shows force. We can't deny or restrict a person to access to their equipment or the devices or wheelchairs or walkers or hearing aids or communication boards. So we can't take these things away from a person. And we can't use painful techniques. We can't hyperextend someone or twist their body parts. We can't trip or push a person or use punishment of any kind. We can't require a person to assume or maintain a specified physical position or posture. We can't force exercise. We can't totally or partially restrict a person's senses. We can't present intense sounds or lights or other stimuli. We can't use noxious smells or taste or substance or spray. We can't require a person to earn normal goods and services. We can't use token programs where things are taken away. We can't use a person receiving services to discipline another person receiving services. And we can't use any action or procedure that is medically or psychologically contraindicated. So these are prohibited procedures that can never, ever be used. They are against the law. But here are some things that we can do and that are allowed. So allowed physical contact. We can hold the person to calm and comfort them. We can protect a person at risk of frequent falls. We can protect them by catching them if they fall or holding them if they fall so that we prevent them from falling down on the ground or hurting themselves. We can assist them. We can facilitate a person's completion of a task or response when a person does not resist or minimally resists. So if a person needs hand over hand assistance, we can do that, just as long as we're not resisting or minimally resisting. We can redirect, we can block, we can redirect a person as long as it's less than 60 seconds of contact. And we can redirect behavior, not posing a serious threat with less than 60 seconds of contact. So if we're touching a person or redirecting, it needs to be less than 60 seconds. But these physical contacts are allowed. Also, these are allowed. So positive support strategies are allowed, and what we talked about earlier. So positive support strategies are person-centered, individualized, strength-based, and skill building. We can offer positive verbal correction. We can temporarily withhold or remove an object being used to hurt self or others. But we would return that object as soon as possible and not hold it as a punishment or a way to control. We can use mechanical devices for medical conditions, such as if they need a safety strap on their wheelchair, that's allowed. And then we could use an emergency use of manual restraint if there is an immediate risk of serious harm for which there is no other option for safety. So let's say, for an example, here at Tolad, we're not allowed to use emergency use of manual restraint. However, there may be a situation in which you might have to, where there is no other choice. Let's say you're working with an individual and they're about to run out in the street. The only option that you have to grab them is to grab them and pull them back. Otherwise, they might have been hit by a car. So an incident like that, so you can use an emergency use of manual restraint, it's allowed, but it's the very last option. You can't grab somebody and manually restrain them. But if it's used as a last resort, and if you had to use it to pull someone away from getting hit by a car, then that is allowed. There's a good chance that the individual that you're working with may have a mental health diagnosis. And so we need to talk about what we would do if there was a mental health crisis. So how would we respond to that? It's important to read and understand each person's support plan. Staff should implement any crisis prevention plan specific to the person that they're working with, if it's in their support plan. And it's important to try to de-escalate and minimize and prevent a crisis from occurring before it starts. If a client is having a mental health crisis, stay with the individual to make sure they are safe. Do not leave them alone if possible. Call 911 or the Mental Health Crisis Intervention Team, which is called COPE. And their number is 612-596-1223. Explain the situation to that person, that the person is having a mental health crisis. Follow any instructions provided by the 911 operator or the Mental Health Crisis Intervention Team. And then notify Tolad office, who will make sure that to contact the appropriate team members and to coordinate further care. If an individual that you're working with is having a mental health crisis, there are here are some of the de-escalation techniques that you can try. You can stay calm. You can ensure safety. You can maintain personal space, limit stimuli, offer choices, try to avoid confrontation. You can encourage deep breathing for the person. You can practice actively listening. And you can use empathetic statements like, I hear what you're saying, that sounds hard. Or you can shift the conversation to a different topic, or you can set boundaries. Each person's plan has positive support strategies written into their plan, which do include probably some de-escalation techniques that staff can use. This helps the person just to feel understood and valued. And then when we use empathetic statements, we express, understanding and empathy for their feelings. Phrases like, I can see why you feel that way. Those validate the emotions without agreeing or disagreeing with the perceptions. You can just give plenty of space between you and the individual so you don't get yourself in a situation where you're feeling trapped or threatened. You should always stay at least arm's length away so that there isn't a chance that a client could strike you or hit you in some way. Also, avoid touching them without their permission and limit stimuli if you can. Reduce lights or noise or the number of people in the area, which can lower the person's stress level as well. And then if there are any other individuals that are in the space receiving services, and if it's possible, try to move those individuals out of the area and offer just to keep them safe. When an individual is in a mental health crisis, it's just important to offer choices so they feel like they have some control. Um, you could also use diversion techniques, gently shifting the conversation to a more neutral topic or engaging the person into simple, non-stressful activity that could help them diffuse the crisis. You could try to change the subject to offer something else for them to do. And then if you need to set clear and simple limits, you can set those limits, but do so clearly and respectfully. Explain the consequences of their action in a way that's easy to understand and focusing on safety and care. Avoid raising your voice or, avoid confrontation, loud yelling. Do not argue or challenge them or demand them in any way that could, escalate the tension. It's important for you to stay calm. And it's important for you to stay mindful and being mindful of your body language and avoid appearing threatening. And then, if you can, just try to encourage the individual to do some deep breathing or just get in the present moment. Or maybe they need to step aside and go in the room just for some quiet time to decompress. So now we're going to be talking about the policy and procedure regarding incidents and what you need to do to respond to an incident, and what you need to do to report, and what you need to do to review. So what is an incident? Well, a serious injury a serious injury is considered an incident, such as like if someone were to break their bones or their fractures or have a head injury, if there was any cuts or lacerations, third-degree burns, second or third-degree burns, frostbite, if someone loses a tooth, or if they use more than one tooth, if somebody injures their eyeball, if someone accidentally swallows some kind of foreign object or substance, if there's some kind of near drowning or exhaustion, if there's attempted suicide, or any other injuries or incidents considered serious by a mental health professional. These are all considered serious injuries. Also, death and medical emergencies or mental health crisis, any situation where you would need to call 911 is considered an incident. So if you were to, let's say, lose a client and you're not sure where they went, that's considered an incident. Um, if, let's say, a conduct of a person, if a client is causing abuse to another client, that's considered an incident. Any sexual activity, if you had to use an emergency use of manual restraint, that is considered an incident. And then suspected abuse of child or vulnerable of adult abuse. Any type of suspected abuse is considered an incident. All of these things are considered an incident, and when there's an incident, there's reporting that needs to happen. And that's what we're going to get to on the next slide here. So this is an incident report. So these incident reports are kept at each Tolad house. If there's an incident, you must report it within 24 hours, like we talked about earlier. By law, you need to report an incident within 24 hours. And then we must have you complete an incident report. And we're going to help you every step of the way to fill out this incident report, but we need as much details on this report as possible. So that includes like the date of the incident, the time of the incident, the location of the incident, then a description of the incident, and then the response. So anytime that there is any type of incident, you need to do this incident report and report it within 24 hours, because you also need to call the guardian and you need to call the case manager to make them aware. I'm going to pull up an example of an incident report and where I want you to fill it out. Okay, so you've seen these at the house. Just making sure that you complete every line here, the location, the date, the person, the name of the program, and if you have the license number, great. So then you check here the type of incident. Was it a death or serious injury? So if it was a serious injury, then you check, this is considered a serious injury. Was there any of these that happened? Or was it a medical emergency, or was it a mental health crisis, or was an act involving that a person that we needed to call 911? So all those things that we talked about earlier. So if there was an emergency use of manual restraint, sexual activity, or maybe a potential maltreatment, this is the form that's at the house that you need to fill out in detail. So then here you describe the incident, and this is where we need you to have as much detail as possible. I want to know what happened before the incident to cause it, what happened during the incident, and what happened after the incident. and then just description of the staff respond. How did staff respond to the incident? And if there's not enough room to fill it out on this incident report form, write it on the back. It's okay. You don't have to squish it all in this space right here. You can write it in the back. So then once an incident happens, remember, we need to notify the case manager and legal rep within 24 hours. So here you put, did you contact the case manager, the date and time? Did you contact the legal representative, date and time? And then this is the internal review. This is where you check where the policies and procedures follow. This is what Miss Yummy would fill out, or I would fill out after I got this incident report. But the most important thing is I need the details of what happened in this incident, because a lot of times I have to create a report online to send to DHS. And DHS has a lot of follow-up questions, like what happened before, what happened during, what happened after, how did the staff respond, how did the client respond? So I need to know as much detail as possible. So maybe if there's not enough detail here, I may have to come back to you and ask you to complete it again, just to include more details. But just remember, you must fill an incident report when any of these things happen. And remember that this is also in the policy book. You don't have to remember this all. It's all in the policy book that's kept at the house. So you can always refer to the policy on reporting incidents, and it will walk you through exactly what you need to do. Just look at that policy book. Next is we're going to be talking about the policy and procedure on grievances. So understanding the complaint process. So individuals have the right to speak up and be heard. If a client comes to you with a complaint, you must help them every step of the way to write a formal grievance. So complaints from the client go to the Tolad office. And then Tolad, they review the problems. They'll look at those problems or investigate the complaint within 14 days. And then they will solve the issue within 30 days. So Tolad will check everything to make sure that we're following the rules. And if we need to retrain staff or make changes, Tolad will do that. Then Tolad will fix the problem and make sure that it doesn't happen again. We'll write down what happened, how we solved it, and let you and the case managers know. But you as a staff member just need to know that a client has the right to make a complaint. And part of your job as a staff is to help the client if they need help filling it out. So if you're not sure, you can contact me or Miss Yummy at the Tolad office, and we can help you with that. But just remember, the client has a right to make a formal complaint. The next policy we're going to talk about is the policy and procedures on data privacy. So we must protect our clients' private information. Things like personal information, health details, financial matters must be kept safe and private. Staff will only have the information they need to do their jobs and no more. We are very careful to make sure that the client information is not shared with unauthorized agencies or people. Tolad follows the Minnesota privacy laws and the Health Insurance Portability and Accountability Act, otherwise known as HIPAA, to keep client information safe. So it's very important that we don't share information with unauthorized people about the clients. It's your job to ensure that their data and their privacy is not shared. Next, we're going to be talking about the policy on universal precautions and sanitary practices. So universal precautions apply to the following infectious materials. So blood, bodily fluids visibly contaminated by blood, semen or vaginal secretions. All staff are required to follow the universal precautions and sanitary practices, which includes proper hand washing, the use of gloves when you're in contact with infectious material, the use of a gown or an apron if there is a risk of your clothes becoming soiled with infectious materials, the use of a mask or eye protection if there's any splashing that might be possible, use of gloves and disinfecting solution when you're cleaning a contaminated surface, and then just proper disposal of sharps so that those syringes and needles are taken care of properly. The use of gloves and proper bagging when you're handling contaminated laundry. So keep this in mind. This is called the Universal Precautions, Sanitary Practices, and Prevention. It's to keep you safe and the client safe. And it's important to remember that it's to use these tools at your disposal. It's important to wash your hands, wear gloves, wear goggles if you need to. And if you don't have these materials at the house, let the Tolad office know that you would like to have gloves or goggles or a gown or a mask or an apron of some kind, and we can get that for you. The next policy we're going to be reviewing is the policy and procedures on safe transportation. We want to ensure safe rides for everyone. So you must follow all driving laws, have a valid driver's license, no eating or drinking or smoking or using your cell phone in the car, make sure that everybody wears their seatbelts, help the individuals in and out of the car however they might need help with ramps or steps if needed, and then also use special seats for kids in the car if you have a small child that you're transporting. We just want safe rides for everyone. The next policy is the drug and alcohol policy. So this is a big one. Tolad employees are not allowed to be under the influence of alcohol or illegal drugs or impaired by any other chemicals or prescription drugs or legal drugs even. So if you're taking a prescription drug and it's legal, but it impairs your ability to provide services to a person, then you can't use that drug at work. So drugs and alcohol, illegal drugs, or even prescription drugs, if it impairs your ability to work with an individual, you're not allowed to be under the influence of any chemicals or illegal drugs. This could, if Tolad does find out that you're under the influence, that could lead to termination of your employment. So this is very important. No use of drugs or alcohol or chemicals or illegal drugs or even prescription drugs. If it impairs, for prescription drugs, you can't use it if it impairs your ability to work with an individual. The next policy we're going to talk about is the policy and procedures on emergencies. So emergencies are events like fires or severe weather, natural disasters, power outages, and situations when calling 911 is necessary. Emergencies like fires, severe weather, natural disasters, and power outages are situations calling 911 is necessary. So for severe weather and natural disasters, staff will ensure everyone's safety. They will monitor the weather conditions and guide people to safe areas and follow instructions until it's safe to return. For fire, staff will immediately activate the alarms, evacuate everyone, call 911, and try to contain the fire if possible and follow instructions from authorities. For power failures or gas leaks, staff will keep people safe, contact the utility companies, and evacuate if needed, and follow safety protocols until the situation is resolved. Emergency evacuations and relocations. Staff will help people gather the necessities and coordinate with other authorities if evacuation or relocation is necessary. For all other emergencies, staff will cooperate with authorities during events like pandemics. Reporting emergencies, staff will immediately inform managers, the Tolad office, and they will document these incidents and they will document these emergencies and report to the legal representatives and the case managers. And they'll ensure privacy when they're sharing information on these incident reports. Again, if it's a serious injury or an incident or an emergency, all of these things are considered that you need to report them within 24 hours. So if there's any type of emergency would turn into an incident, and you would need to report that within 24 hours, and then also fill out one of those emergency reports.
Next, we're going to be talking about the policy and procedure on medication administration and documentation. When administering medications, it's important to follow the 7 R's: the right person, the right medication, the right dose, the right route, the right time, the right documentation, and the right reason. And we'll go into each one of these. The right person. When you follow the 7 rights, we reduce the risk and ensure safe, high quality of care. So take your time, stay focused, and remember, giving medications is a serious responsibility that requires attention to detail. Next, the right medication. Be sure you're giving the correct medication. Read the label before you open the bottle, and again as you remove the medication, and once more before you give it. That's the 3 checks rule. So medications can look very similar in color and shape, so it's always important to read the full name carefully. Pay attention to the combination of drugs or medications that come in different strengths. So if a name looks unfamiliar or doesn't match what's on the MAR exactly, stop and confirm with your supervisor or the pharmacy first before you give the med. For the check the label 3 R's, that's a 3 checks rule. Check the label before opening the medication bottle, and then check it again. Check the label when removing the medication from the bottle, and then check the label one last time before giving the medication. That's the 3 checks rule. Then verify the right dose. Compare the label with the MAR to make sure the amount matches what's prescribed, so no more and no less. Ensure that you're giving the medication in the correct route. So route means the how the medication is supposed to enter the body. So common routes include oral, which means by mouth, topical, which means on the skin, and then there's rectal, and then sublingual, which means under the tongue, and then there's subcutaneously, which means injected under the skin. Each route affects how the medication works, so it's critical to follow the directions exactly. Never change the route on your own. Give medications at the correct time, as listed on the MAR. Timing can affect how well the medication works and helps maintain consistent levels in the body. Some medications must be taken before meals, some must be taken after meals, some others at bedtime, and then some meds are taken at exact intervals. So if a dose is given late or if it's given early, it can cause side effects or it can reduce the effectiveness of the drug. So follow Tolad's policy, for example, and give medications within 30 minutes before or 30 minutes after the scheduled time. And then if for some reason you give a late dose, you need to document that. Always document immediately after giving the medication. Every initial on the MAR is a legal record, so your documentation must be accurate, complete, and legible. This record protects both you and the person receiving the meds. If you notice an empty box from a previous shift, make a note in the communication log to remind that staff to initial, but never initial for someone else. Understand why the person is taking the medication. Knowing the purpose helps you monitor for effectiveness and potential side effects. So, for example, you might give a PRN for pain. Understanding why helps you recognize when a medication is truly needed and when to report changes to your supervisor. So, always check the care plan or the MAR if you're unsure of what a medication is for, and observe how the person responds. So, when we follow the 7 rights, we reduce risk and ensure safe, high quality of care. So take your time, stay focused, and remember, giving medication is a serious responsibility that requires attention to detail. For MAR documentation, always put your initials in the MAR for every shift and only for the medications that you administered. Be careful only to put your initials on the correct row. For an example, if you work in the AM, you would not put your initials in the PM row. So just being extra careful and attention to detail of where you're putting your initials. Before the end of your shift, make sure there's no holes in the MAR, and if there are, make sure you put your initials. If you see a missed initial from a previous shift, leave a note in the MAR or call the staff or put a note in the communication book to let staff know so they can go back and put in their initials. If a client refuses medication, give them some time and then ask them again. And if they still refuse, try a few minutes later and then ask them a third time. If they still refuse, put an R in the MAR instead of your initials. So you want to ask them at least 3 times before you give up trying to offer it to them. And then right on the back of the MAR, you put an R on the MAR, and on the back you put so and so refused their meds. Staff attempted 3 times, but client refused. If a client is away from home due to going on vacation for the weekend or going home for the weekend, or maybe they're at their day program, or maybe they're even in the hospital, make sure you put an L for leave on the MAR. And then right on the back of the MAR where the client went. For an example, if they went home for the weekend, you would put client went home for the weekend. Or if they were in the hospital, you'd put they went into hospital. So just put an L for leave, and just make sure you only put that L for when they're gone. For PRN medications, those are medications that are only taken as needed. Make sure that when you give a PRN medication, you put your initial in the MAR and then you write the time that you gave that medication. So if someone said, I had a headache, have a headache, and I would like some ibuprofen, then you would put your initials on the right day for the right person, and then you would write in, I gave ibuprofen at 3 p.m. And then on the back of the MAR, you would put why you gave that person the PRN med. I gave John Doe his ibuprofen because he reported he had a headache. And then you would go back and check with him later to make sure that his headache was gone. And then you'd put that in the MAR on the back of the MAR as well. For medication orders and refills, if a doctor changes a medication order for an individual, we must get that prescription from the doctor before we can administer these changes. So if you take an individual to the doctor, make sure you get any prescriptions that the doctor ordered and make sure it gets to Geritol. Any medication changes must be sent to Geritol so that the MAR can be updated. If we notice that a med or is wrong, we need to check with Gerotom first and see if that was a mistake with Gerotom. And if not, then we need to check with the doctor to get that prescription corrected. If a medication is getting low, you must contact the pharmacy at least a week before the medication runs out so that Gerotom can deliver the medication refills. And then if medications were not delivered on time and there's no meds to be given, circle the box on the MAR of where you would normally put your initials and then write a note on the back of the MAR as to why the med was not given, and then call Gerotom to deliver those medications as soon as possible. And then be sure to follow the Tolad policy if a medication was not given. If it was missed or forgotten, or if it was due to Gerotom, you need to contact the person's legal rep and Tolad administration.
All right, next we're going to be talking about the policy and procedures on health service coordination. We make sure that people get the right health care and the services that they need with Tolad. So we ensure the continuity of care as outlined in their support plan. We ensure decision making is based on person-centered philosophy and medical expertise, and we coordinate with licensed healthcare professionals if there is no in-house nurse available. And we also document and meet the health needs needed according to the person's support plan. And then, we notify the legal reps and the case managers if there's any significant health changes. We determine health monitoring plan with healthcare providers. We train staff to safely use medical equipment if the individual needs medical equipment. And we provide specialized training for critical equipment if somebody needs it, such as oxygen. So everybody has received training. If someone uses a glucometer, their staff have been trained on how to use that. And there's also instructions in the med book of how to use that glucometer. So for life-sustaining equipment, right now there's no individual at Tolad who is using any equipment used to sustain or monitor any medical conditions that could become life-threatening without proper use. So just know that we're not allowed to use any equipment that is used to monitor life or medical condition that could become life-threatening. We're not allowed to use it unless we have been trained by uh, the staff that are trained in this medical equipment. So right now, there are no life-sustaining medical equipment that's being used for any of our individuals, but just know that if, for an example, if a client were to use an oxygen machine or a feeding tube or a suction machine or ventilators or things like that, that staff would have the proper training before they must have the proper training before they start using that equipment. Because if they did it wrong, it could become life-threatening. So staff would be trained on exactly how to use that equipment before they use it. All right, basic first aid. All right, equip yourself with the knowledge to respond confidently in common emergency situations. First aid is the immediate care that you give someone who is injured or is experiencing a health crisis before a professional arrives. The right first aid can prevent a situation from worsening and can even save lives. So the essential first aid kit contents include, so what you would need, these are must-haves that you must have in your first aid kit: Band-Aids, sterile gauze, adhesive, tape, scissors, tweezers, gloves, antiseptic wipes, to keep your kit easily accessible, and then just make sure that you replace any items that become outdated or used up. So that is some of the things that we need to have in our first aid kit. So how to handle minor cuts and scrapes. So first off, you must wash your hands and then gently wash the wound, apply an antiseptic cream, and then cover with a sterile bandage. Just a reminder, prevent infection by ensuring that everything that touches the wound is clean. So make sure you wash your hands and then gently wash the wound, apply some pressure, wash out the cut, and then put the bandage. For burns, so for immediate action, cool the burn under running water for 7 minutes. Cool the burn under running water for 7 minutes. Then cover with a sterile gauze, not cotton, and avoid applying creams or ice. If the burn is larger than your palm or if the skin is broken, make sure you seek help. Consult a doctor. So you would probably have to take that individual into the emergency room or some kind of clinic. So if the burn is bigger than your palm or if the skin is broken, make sure you seek help. So this is the universal sign for choking. If you see someone choking, the initial check is to see if they can cough or breathe or speak. And if they can't, encourage coughing if it's possible. For severe choking, use abdominal thrusts. Only if you're trained. Tolad staff are trained on first aid and CPR every 2 years, but make sure that you use your abdominal thrusts. And if you're not trained or if you're unsure, just call emergency help immediately. Recognizing a heart attack. So some symptoms include discomfort in the chest, arms, back, neck, jaw, or stomach, shortness of breath, cold sweat, nausea. So immediate steps, call 911 right away. Help the person to a comfortable position and reassure them and monitor their condition. Dealing with fainting. So before someone faints, if they feel like they're going to faint, have them sit or lie down and then lower their head. If they do faint, after they're done fainting, ensure that they are breathing and that they're on their side and check for injuries if they fell. Call 911 if necessary. But if they start to feel like they're going to faint, just make sure that they sit down and lower their head lower than their feet. And then if they do faint, just make sure that you try to support them as they're going down and making sure that they're breathing and making sure they didn't hurt themselves when they fell. First aid for sprains. Remember the acronym RIGHT: rest, ice, compress, and elevate. And that helps to reduce the swelling and the pain. So avoid using the injured limb and apply ice wrapped in a cloth to prevent ice burn. So you rest the injured area for at least 48 hours, ice it for 20 minutes at a time, 4 to 8 times a day. Compress it to reduce the swelling, and then elevate the limb 6 to 8 inches above the heart. This helps reduce swelling. First aid for bloody nose. So pinch the soft part of your nose closed with your thumb and index finger. Hold your nose like this for about 5 to 10 minutes. Keep an eye on the time. So breathe through your mouth. Don't tilt your head back. This can make you swallow blood, which might cause you to have a stomach upset. And then after about 10 minutes, check if the bleeding has stopped. If it hasn't, keep pinching your nose for another 10 minutes. Don't blow your nose right after the bleeding stops. Wait a while and let it heal. If the nose keeps bleeding after 20 minutes, or if it's due to a bad injury, see a doctor immediately. All right, so now we're going to talk about the policy and procedures on admission. So before Tolad admits a new person to the program, we make sure that the person and their legal representative, um, that we meet with them and review their admission criteria. And we want to review the service recipient rights with the person. We want to review the program policies with the person and the legal rep and the case manager. And we want to make sure to obtain any authorizations like authorization to manage money or property, or authorization regarding financial statements, or authorizations to administer medications. We just need to make sure when we're admitting a new person that we complete all the required intake. When we admit a new person, there's a lot of paperwork that must be completed before the person can start to provide services. And then also the new staff need to be trained on the new individual's plan, including the person's specific needs and the person's individual abuse plan. And staff need to be provided training on that before they work unsupervised. So staff need to be trained on the new person. All right, next we're going to be talking about the policy and procedure on temporary service suspension and service termination. Before Tolad would ever consider a temporary suspension of services, or if they were to consider service termination for a person, Tolad would always collaborate with the person's team first. So there's a lot of things that we do first before we resort to suspending services or terminating services. So we try additional positive support strategies to see if we can get the problem solved that way. We try as many least restrictive ideas as possible. We talk with the person and their support team to try to solve problems collaboratively. And then we ask the case manager for help. Maybe we can get some behavior support or crisis intervention services. So before we can even attempt to suspend or terminate, we have to try a lot of things first. And if we still end up providing a service suspension or termination to a person, we need to give them a 60-day notice for service termination. So an individual will get 60 days notice if they, and there's only certain examples where we could even provide service termination. You can't just provide service termination because somebody's hard to deal with. There's only certain incidences that we could actually terminate or even suspend services. And then before we even do that, we need to be connecting with the team and trying everything we can first before we resort to that. All right, so minimizing the risk of sexual violence. Our focus will be on empowering individuals with disabilities through educating them on healthy relationships, understanding consent, and reinforcing the importance of bodily anatomy. Sexual violence is when someone forces or tries to force another person into a sexual activity that they don't want. It could mean forcing someone into sexual activities for money or treating someone badly because of their sexual feelings or identity. This can happen to anyone, no matter how well they know the person hurting them. People with disabilities might be more at risk because they often need more help from others, or because some people wrongly think that they can't make their own choices about their bodies. It's really important to understand these issues and to stop them from happening. That's why we need to teach individuals on healthy relationships, bodily anatomy, and consent. Healthy relationships are based on mutual trust, respect, honesty, and open communication. For individuals with disabilities, it's essential to recognize and foster relationships where they feel valued and respected. Key characteristics include equity, respect for independence, supportive communication, and we must teach and model these values. Consent. Consent is a clear and enthusiastic yes to engage in a specific activity, and it can be revoked at any time. It's crucial to communicate that everyone has the right to give or withhold consent, and that right extends fully to individuals with disabilities. Understanding and respecting consent is fundamental to preventing sexual violence. They have the right to say no at any time. And bodily anatomy means having control over one's own body. It's about respecting the individual's rights to make decisions, and it's about their bodies and their personal spaces. This concept is critical in teaching people with disabilities that they have the control over their own bodies, and they have the right to say no to unwanted touch or actions. They have control over their bodies and have the right to say no to unwanted touch or actions. And it's important to teach individuals that. Those who take care of others, I mean, we have a big job to keep everybody safe. So, what this means is teaching about respect, helping everyone understand their rights, and always being ready to help if someone seems to be in trouble or in a relationship that seems unhealthy. So, we need to speak up and speak out if we see things. So, again, this goes back to we are a mandated reporter. If we suspect that there's any kind of sexual abuse or violence happening, since we are a mandated reporter, we must report that within 24 hours. It's the law. Right, next, we're going to be talking about cultural competence. Cultural competence is the ability to understand, respect, and work effectively with people from different cultures. Cultural competence helps us provide better support and care by recognizing and respecting the diverse backgrounds of people that we serve. Cultural competence improves communication and trust. It enhances the effectiveness of our services, and it respects and values diversity, leading to a more inclusive environment. And there are some steps that you can take to improve your cultural competency, which are educating yourself, attending workshops, reading, and engaging in diverse cultures. Also, listen and learn. Be open to learning from experience of others. Ask questions, don't assume. Asking respectful questions can increase your understanding. Reflect, think about your own culture, and assumptions and biases. And lastly, adapt. Be willing to adapt your approach based on your cultural knowledge. So each client has their own individual support plan. It's located in the home, and staff must review and receive instruction on this person's support plan as it relates to the responsibilities assigned to the program. So the individual's abuse prevention plan, staff must read the individual abuse prevention plan so that they can achieve and demonstrate an understanding of the person as a unique individual. and so that they can understand how to implement those plans. Staff must not work unsupervised with the person until they are trained on the person's support plan, including the individual service recipient needs. So it's really important to read the person's plan, especially after their annual meeting or their semi-annual meeting. It's important to read through the book and get to know what are the positive support strategies for this person? What's important to the person? What's important for the person? Look at the plan to see where it's person-centered. Look to see how staff are to support the person. Read through this plan so that you know the best way to help this person that works best for them. Can't stress enough that how important it is to know the individual support plan. It's updated at least yearly, if not more than that for a lot of the folks. So look in each person's book, read through their plan, read through their support plan addendum, read through their individual abuse prevention plan, read through their self-management assessment, read through their outcomes. Every person has a goal, at least one goal that they need to work on. So read through the person's goals and learn how to document on the data sheet for their goals. It's really important to know each person's plan really well and how to support them in the way that they like to be supported. So like I said, every client has at least one goal that they're working on, one good person-centered goal. It's important that staff read and understand each person's goals so that they can help them work towards success. If the person you are working with has a specific goal, which they do, you must fill out the data tracking sheets each time that you work with them on their goal. We need staff to do this so that we can monitor each client's progress on their goal. State law requires that a client has a measurable goal that staff can measure and, and quantify. So having each client work on a person-centered goal that we can see and that we can measure, and then tracking how they're doing on their goal, that helps Tolad to review the goals. And then when we meet with the team, we can talk about how they're progressing on their goal. And then we can talk if we want to keep the goal as it is, do we want to change the goal, or do we need to get rid of it and make a new one? Helping the client with their goal and documenting on their goal is a very, very important part of their job. It's part of person-centered care. So each time we work with an individual, again, 245D, Minnesota law, requires that we need to write a progress note or a log note, talking about exactly what the client did when they worked with you. So you need to write what they did and how you helped them. You need to tell a story about everything that you did to help them with the whole time that you worked with them. This helps DHS understand how staff are providing the support. You can write in multiple sentences. You don't need to write one sentence. And when you're telling the story about what you did for the person during your shift, tell what happened during the person's day. State only the facts. Don't make assumptions or don't share your feelings. Don't write other people's names in the log note for that person due to privacy logs. We can't write other people's names in log notes. And also, we can't write other people's names in incident reports either. So if an incident happened and you're writing an incident report, if it's about one client, you can't put another client's name in that incident report. You need to make two incident reports, one for one client, one for the other. So just keep that in mind. When you're documenting about a client, you can't put other clients' names in the log note. And then when you're writing that log note, talk in third person, like pretend that you're talking about someone else, not yourself. So when you're talking in third person, instead of saying, I took John to the mall, you would write, staff took John to the mall. So that is something to keep in mind when you're writing it. Keep it objective. Don't put your feelings in there. Don't make assumptions. Don't say John was mad because you're making an assumption he was mad. You could put John seemed upset. John was raising his hand and his fist, which made him seem upset. But you can't say he was mad because you can't make an assumption for how somebody is feeling. So keep it objective. Um, you can't say so and so had a good day because you don't really know if they had a good day. So you say John seemed to have a good day. John seemed to be in a good mood. So keep it objective when you're writing that log note. DHS, when they come to do an audit, they will read those log notes. So make sure that you keep that in mind when you're writing a log note, that DHS is going to come read those log notes. So keep them professional and objective and in third person. And they must be done for every shift. All right. Anti-fraud. So just as a reminder, it's a federal crime to provide materially false information on service billings for medical assistance or service provided under a federally approved waiver plan. So what that means is if you say that you worked with a person from 4 to 9 then that is when you should clock in and clock out, is from 4 to 9 p.m. Um, and if you gave them medication, you need to write it on the on the MAR that you gave the medication. You can't falsify records. You can't provide any false or misleading information. It's a crime to do so. So keep that in mind. If you see something that you might think is fraud, then you need to report it. This means not letting anyone cheat or misuse the money that they're getting, or making sure that just making sure that all the staff are following the rules. If Tolad gets money from the government to help people with disabilities, we need to make sure that the money is used in the right way. So if you suspect that somebody is being financially abused or manipulated, or their money's not being treated correctly, then you need to report that within 24 hours. And it's important that we never provide false or misleading information when we're writing about the client, or we're writing about meds, or we're writing anything about the finances, anything at all. It's a federal law. It's a federal crime to provide false and misleading information. All right, so that is the end of the training. If you have any questions, I want you to feel free to call me or the Tolad office at any time. I'm going to put the resources here, and you can also take a screenshot of this page as well so that you have it for your records. You can call the Tolad office. You can call me, Missy Loveday, the designated manager. You can call Emmanuel. You can call Miss Yummy. You can call Mark. Um, so you can call any of these numbers here. And remember, if you suspect any abuse, you must report it within 24 hours. And if you have any questions, please don't hesitate to reach out. Thank you for your time today, everybody.